Hello everyone, today we are talking about 15 symptoms that show that you have neuropathy. Now, I'm a diabetes doctor, right? I'm an endocrinologist, I do hormones, diabetes, you name it. Now, diabetes is a big part of what I do, and diabetic neuropathy, and some other neuropathies also that I'm dealing with. And I'm gonna tell you what I would ask to my patients, so you can actually self-diagnose at home by asking these questions to yourself, and then see actually if you have neuropathy to begin with, and then take it to your doctor and see if it is true or not. But that's a good step. 15 questions. You answer that yes or no, yes or no. Then if you have 4 of these, you should be concerned and go to your doctor today. So if you have been experiencing unusual sensations in your leg and feet, it may be more than just a temporary issue. Now, like I said in this video, we are going over that 15 symptoms that could indicate that you have neuropathy. Again, if you answer yes to 4 of these questions that I'm going to bring up, it is time to take action. So, neuropathy can be caused by a lot of things, right? So, diabetes, vitamin deficiencies, exposure to toxins, big time, right? Nerves can get damaged, and they may send incorrect signals to your brain, resulting in these unusual sensations or sometimes no sensations. Many patients, in fact, up to 50% of diabetics, may have neuropathy without experiencing noticeable symptoms, what we refer to as negative symptoms. For instance, they might not have a proper sensation in the soles of their feet and remain unaware of it. Now, during examinations, they may not even exhibit like proper ankle reflexes. That you can actually do the exam in another video. I'll talk about that, how to self-examine yourself. Today, we're talking about symptoms only. But you may have, for example, condition like a hammer toe without realizing that these are signs of neuropathy. When neuropathy presents with symptoms, actually it indicates pretty serious progression already. That's why I always advise my diabetic patients to incorporate antioxidants like alpha-lipoic acid, benfotiamine, B-complex vitamins into their routines to help prevent development of neuropathy. People just want to wait until to the end of the road before they do anything, right? That's human nature, but get over that, right? So, if these precautions are taken, you control your diabetes, you take your vitamins and supplements, you do the right thing, you exercise, you will be fine. Nothing is a guarantee, but when you do the right things will come to you. Some patients come to me with like calluses, and they say, oh, it's just a callus. And next thing you know, they have ulcers on the same place where ulcer was. I witness that frequently, and I don't want that to happen to you. Now, number 1 question, are your legs or feet numb? Yes or no? Simple question, right? And by the way, it always starts on your feet, not on your hands. So sometimes it affects the median nerve, like we call it carpal tunnel, that can happen isolated. But a typical presentation of neuropathy starts on the feet. We'll talk about that a little bit more detail in another video. Now, number 2, do you have any burning or painful sensation in your legs or feet? Yes or no? Number 3, are your feet too sensitive to touch? For example, you're sleeping and next thing you know, the sheets are bothering you. Like, what? They're weird. It feels weird on your feet. It may be actually, tender or even painful sometimes. Or normal touches may feel painful to you. Number 4, do you get muscle cramps in your legs or feet, especially at nighttime? Yes or no? Now, by the way, you can also tell us what you think you have and what your symptoms are and share with us in the comment section. And we like to have this community feeling where everybody learns from each other. Number 5, 5th question. Do you ever have any prickling feelings in your legs or feet or toes? Yes or no? 6th question. Does it hurt when a painful stimulus, like a sharp object, you step on it or something, did it hurt? If it didn't hurt, well, that's actually a problem. So too much of a pain from nothing is a problem, and not having a pain at all from a painful situation is also a problem. Number 7, when you get into a tub or a shower, are you able to tell hot water from the cold water? Or how well can you tell? Number 8, have you ever had an open sore on your foot for any reason? Yes or no? Again, remember, this is 15 questions. You don't have to have all of these things. If you have 4 of these 15 questions, more than likely you have neuropathy. Number 9, has your doctor ever told you that you have diabetic neuropathy? That's a simple one, yes or no. Number 10, Do you feel weak all over your body most of the time? Yes or no? And number 11, are your symptoms worse at night? Any symptoms, not just pains or cramps. Number 12, do your legs hurt when you walk? Yes or no? Number 13, are you able to sense your feet when you walk? Like, can you tell that, your feet is really touching the ground? A lot of people actually tell me that they, for example, don't even feel the gas pedal and the brake pedal anymore. Not good. Don't drive, right? If that's the case. Number 14, is the skin on your feet so dry that it cracks open? Yes or no? And if it is the case, actually dry skin is a part of neuropathy. Most people don't know that, but it is, and it can be. And when it's so dry and cracks open, it invites the bacteria, and there you go, now you have an ulcer. And number 15, have you ever had an amputation? I hope nobody says yes to that question. But obviously, if you had an amputation, some people are so naive to not realize that it was from diabetes. These are the 15 questions, and now it may be time to take action, right? Schedule an appointment with your doctor. Now, a lot of doctors will give you medications, right? Podiatrists, foot doctors will know a lot about alpha-lipoic acid and benfotiamine and things like that. Ask them, hey, I have this SugarMD neuropathy support that has, the everything like alpha-lipoic acid, benfotiamine, acetyl L-carnitine, B complex vitamins, and vitamin D. Is it good for me, right? So if they know anything about alpha-lipoic acid or benfotiamine, which, like I said, a lot of foot doctors will know about it, go for it. And this is a preventive thing, right? A lot of people wait until the pain is so miserable, so bad, before they do anything about it. And at that point, the only thing they can do for the pain is a painkiller. Actually, most of diabetics do have neuropathy without knowing. It's only understandable or diagnosable if we ask the right questions and if we do the right examination before the symptoms happen. But like I said, 50% of people already have it. To prevent that, the progression to the painful situation, you need to really take a lot of antioxidants, in this case, alpha-lipoic acid, benfotiamine, and B-complex vitamins. Why? Because your body is utilizing them so much. As a diabetic, you're producing so much oxidation in your body because of the inefficient mitochondria, or that Krebs cycle, the tricyclic acid cycle that's not working right. And you have a lot of this polyol pathway, hexosamine pathway, sorbitol production, a lot of accumulation of gunk in lay terms. And that really blocks the system and creates a problem in clearing the radical oxygen species, which are okay in low amounts. You have to make reactive oxygen species for your immune system to work. But in diabetics, they produce so much of it and they cannot clean it, and it becomes toxic to your nerves. So as a result, you need a lot of antioxidants for cleanup. So that's the purpose of these supplements. Now, like I said, if you answered yes to 4 of these 15 questions, I would say do everything you can yourself and then maybe see your doctor as well. But if you are conscious, really, you can do like 80-90% of the things at home yourself by just listening to the advice that I'm giving in these videos. And if you go to the doctor, and doctor may say, hey, you have neuropathy, but also let's do a test for your arteries. Maybe you have arterial blockage at the same time. So seeing a doctor helps from that standpoint, that although you think you have, but they may also uncover some other aspects of your health. Again, neuropathy is considered a silent disease for many people. So realizing that it may not have symptoms is the first step. And if you're having any unusual sensations in your body, listen to it. Don't ignore it, because your body actually don't give symptoms until it is pretty late. So paying attention to that and stopping the process at its roots is your best bet to prevent the foot ulcers, infections, amputations, and so forth. Because of the neuropathy, a lot of people even get into falls and fractures and balance and coordination problems. So it's a big deal. There's no cure for neuropathy, but you can stop the progression of the problem, and then your body will take its time to heal. But if you're constantly creating damage and not creating the healing environment, then of course it will just get worse and worse, and you're going to end up being medication dependent, and you're going to be exposing yourself to medication side effects. So seek medical help, but do a lot of homework yourself at home as well to make sure that you don't need those medications at the late stages. But thanks for watching today. Please give a thumbs up right in the comment below. what you think about today's video and how it helped you. And we definitely appreciate your time. I'll see you in the next video. Talk to you later. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.